We recognized after a certain case that we were reviewing that we didn't have a great process in place that would easily recognize a mom that was imminently going to deliver their baby within 5 to 10 minutes of entry into our facility. That puts our patient and our facility at risk for delivering the best care that we know we can. To solve the problem, we evaluated our current process and we were looking at opportunities to organize something that really comes in at a lower volume for us to put a strategic way on how we communicate. So, number one, the mom enters to the ED registration area. We never really had it categorized as like imminently going to deliver or maybe delivering in the next 4, 5, 6 hours, and we have our normal process in place. So, what LDRP nurses and team members came around and kind of said, well, how do we respond to a normal situation that has that time in our favor, and how would we speed that up? We easily recognized that we needed to help our registration team members recognize when to alert us and what that alert would look like. We also recognized that as our nursing in the LDRP area is always unpredictable on what's on the unit, we needed to always have somebody that would carry an OB, triage, or immediate phone, and that person would be designated as the person to drop down as quickly as they can with a bag that has all their emergency supplies that they have and need available to them immediately. That took some of the anxiety and the stress out of our team to be able to drop down and know that they always had the tools to do their job really well.
So the team got together and looked at who are the critical people we need to have at that location quickly. This was done with the nursing staff as well as the OB and the pediatric staff. And it amounted from overhead announcements to phone calls to people in the building as well as outside the building to get them here as quickly as possible and the right people in place for those in need.
So in the ER, the triage nurse is there 24/7 to assist any OB patients that come to the ER or ER entrance, and we assist deciding whether the patient needs to be an OB stat, whether we have room in the ER to just take the mom back to the ER, whether we think we have time to get to the OB unit.
So from a registration perspective, we have trained our registration to know when an intimate birth is coming with the help of the ER nurses. If they're huffing, if they're puffing, if they're posturing, if they see any of that right away, they go to the phone and call 222 for the code phone and call OB triage stat to get everything rolling.
So since we have set this process into place, we've been into it probably for approaching about 2 years now. What we recognized is that we had to give a foundational education to everybody. So we did run a couple drills initially when we were going live with it. Since that time, we've probably had up to 6 cases. And those cases are all teaching us ways to make sure that our process is still in alignment and it's going really, really well. There is some opportunity yet on, there's a couple additions that we put into the LDRP bag when they're responding down that they're like, man, I wish I would have had that piece of equipment. And those are continuously getting added or taken away if it's too much equipment that they're taking down and they feel like it's causing more of a complication for them to find what they really, really need during that case. So those are some of the tweaks that we've done in labor delivery so far.
Real world has shown us that we can do a true assessment of who's involved. Are we getting the right people there in the right process? Or do we need to change in the order of notifying people because maybe they're farther away? So we've done a good root cause analysis of everything going forward with communication side of it and notification process.
And in the ER, we've added some equipment that just is one less thing for the OB nurse to have to bring down. And we have an OB room for the mom, and then we have a baby room for the baby, and just some different equipment that we've added through the last couple of years.
And I believe our registration staff is pretty educated on these processes now.